Kia ora koutou katoa, talofa lava. Welcome to today's briefing. Today there are again no new cases of COVID-19 to report in New Zealand, our sixth day in a row without any new cases, so the total remains at 1,154 confirmed cases. There are 12 additional recovered cases, and this total is now 1,474. We only have 8 remaining cases considered to be active. I've also been asked to provide some comment today on the death of Eileen Hunter, a resident from St Margaret's Hospital and Rest Home in Te Atatū, Auckland. We're providing Eileen's name following a request to do so by her family. Eileen was in her 90s. She passed away on Sunday, and she was much loved by all those who knew her. She was confirmed as having COVID-19 in mid-April and had been transferred from St Margaret's to Waitakere Hospital and then to North Shore Hospital for care. Once recovered, with 2 negative test results, she was transferred back to St Margaret's Rest Home. The family has asked the Ministry to pass on their thanks for the care of their mother at St Margaret's and at both Waitakere and North Shore Hospitals. And in turn, I'd like to extend our sympathy to her family for their loss. Now, it's important to note that Eileen was regarded as having recovered from COVID-19 at the time of her death, and COVID-19 is not recorded as the primary cause of her death on her death certificate. However, after consideration, we have decided to include Eileen's death in our overall tally of COVID-19 related deaths, consistent with our inclusive approach to date, so that we have got a good idea of the full impact of this condition on our health and well-being in New Zealand. This means our total number of COVID-19 related deaths is now 22. Again, today there is nobody in hospital with COVID-19, and yesterday our laboratories completed 4,255 tests, and the total number of tests completed to date is 271,690. An update on the NZ COVID Tracer app. It's now had 436,000 registrations. That's 14,000 more than yesterday. I continue to encourage as many people as possible to download the app. It will help us identify, trace and follow up anyone who may need to be followed up if they are a close contact of a case, should we get one. I'd like to also recognise the work being done by businesses and thank them for their work in downloading the QR code. It is quite a process to register for a New Zealand business number. However, thank you that now 18,500 posters are up in businesses around New Zealand, making it easier for people to use our new app to keep a record of where they've been. Just finally, some comments from the World Health Organization. Our numbers today reinforce that New Zealand continues to do well in its efforts against COVID-19, and we need to continue to work together to keep ourselves in that position. The WHO has reminded countries about the need to be careful when relaxing restrictions that have been in place around movement of people, including coming out of lockdown type situations. As the WHO has observed, epidemics tend to come in waves, and a second wave will continue to be a possibility in New Zealand for a number of months from now on. So we need to continue the hard work we've all put in to ensure we continue and maintain our 0 cases, our ongoing downward trajectory, and that we don't allow a second peak to occur. So heading into the coming long weekend, stay safe and well. I'm open to questions.
Crews, are you working on a plan for pilots and flight attendants coming into the country? There's been concerns raised that obviously, seeing as they don't go into quarantine, that could be a way for cases to come in?
Yes, that is a potential risk, and so there is already a very clear plan in place and very clear guidelines around what crew have to do during flights in either direction, and also when they are staying over at destinations. This is particularly for Air New Zealand crew. We're working with the airlines at the moment on looking at ways we may even be able to strengthen that further. That is particularly for flights that go beyond Australia, so flights out at the moment. Air New Zealand has flights two to Asian destinations and 1 to Los Angeles. And we're just looking at how we can make sure that the risk there is really low. And also because we know airline crew are at that increased risk, they will be part of the surveillance testing that we will be doing around the airports and borders to help guarantee that we are keeping, the border tight.
So is there something you'd like to see the crews do more of when they're, say, walking around LAX before flight?
Oh, well, there is very strict guidance for air crews about what they need to be doing, particularly in Los Angeles, both in going through the airport terminal and when they're in their accommodation over there, to help ensure that they're keeping themselves safe and also that they're not carrying any risk of bringing COVID-19 back into New Zealand. And I think that's particularly the destination where we have the most concern about, and that's the one we're looking particularly at other measures we might need to put in place.
What's the official?
With so many days with 0 cases and so few active cases, can you reiterate why we're staring down the barrel of another 4 weeks at alert level 2, and whether there might be some room for movement if we have 0 active cases, if we get to that point?
As we've said before, this virus has a long tail. And I think one could even say, look, the announcement of a further death today from an infection that happened some time ago shows just how long the impact of this disease can be there. And we have also seen that some people are testing positive quite a long way after they might have originally been infected. So there's that aspect of it, but there's also the important aspect, the pillar of our elimination strategy, and that is keeping it out at the border. We've been successful to date since going into alert level 3 and 2, actually since we started the lockdown, and we want to make sure that is all watertight, especially if we're contemplating opening up travel with Australia, which would be under a reciprocal no quarantine required basis. We're stepping through this. I think we've stepped into level 3 and into level 2 rapidly. We've increased the size of gatherings. And as I said yesterday, the work is continuing apace on what alert level 1 might look like, and also our advice around when it would be appropriate to move to alert level 1.
How confident are you when Eileen was sent back to St Margaret's from hospital that she didn't have COVID?
I'm very confident, and I'm confident because the clinicians who sent her back were confident, and I have full confidence in their judgment, and as well as their clinical judgment. Of course, there were the negative tests as well.
When is it going to be okay for businesses to get back to life as usual in the office? I mean, some government departments have said they won't even be back to full strength even under level 1. I mean, do you think government departments should be leading by example and telling people it's safe to go back?
Well, it's safe to go back now. I think there are 2 different issues here. One is we still have the guidance around physical distancing inside the office and work environment. That remains in place. That will be one of the things that will be different in alert level 1, and we're working through that now. But I think there's a second issue, is the experience that workplaces have had of working remotely, which is something that many workplaces have been doing at the margins, and now we've had a sort of a forced experience of it through alert level 4, and workplaces have found actually it is both beneficial for the staff, but and also for productivity. And so I think we'll find many workplaces, even when this is over, the workplace will be different. There will be people who are doing more remote working, and also less travel around, because we've now all become very proficient with the use of Zoom for meetings.
I mean, flexibility is one thing, and that's fantastic that people have that option. But if social distancing is no longer required under level 1, why should government departments be telling their people to stay home if they can?
Well, I can't preempt what government departments will be doing in alert level 1, but I can speak, say, for the Ministry of Health, where we've surveyed our staff and got very positive feedback on the arrangements that were put in place in alert level 4, and over 70% of staff would be happy to retain a mix of working both in the office and at home remotely. So I think, again, it's less about a concern around safety of the workplace. I think all workplaces have been very focused on ensuring their staff are safe. But even as we move into alert level 1, I think we will see a change in the nature of work in that way.
What's the official position on the use of face masks for air travel? And just can you clarify for us, is it elimination or eradication that we're aiming for?
So the advice around face masks for air travel is they are neither recommended nor required, but not discouraged. So saying the international airline staff, as part of the precautions they take, they wear a face mask and gloves when they're in the main cabin and dealing with passengers. So not required on flights, either domestic or international. On the second issue, the strategy is elimination, and I think the difference is here. Really, eradication will be a global effort. It's very hard for New Zealand to say we're on a pathway to eradicate a virus that clearly is still incredibly prevalent and growing in prevalence offshore. And we are very interested in opening up our borders more and more. And in that case, yes, elimination remains the strategy because it's going to be a prolonged effort. And the vaccine, of course, will be part of that in due course.
What will it take for the ministry?
There are talks of plans to fast track the return of international students to New Zealand. Do you have any concerns about that, given that COVID is far from over in much of the rest of the world?
I don't have particular concerns about international students any more than I would other groups coming, if we've got really tight processes around managed isolation and or quarantine when they come, coupled with appropriate exit measures from where they come from. And note here, the significance of the 0 cases here is not just that we've got no cases on shore, but we're not seeing any coming through the border, which suggests that the measures that are in place in the countries where people are coming from are also good, so we're not importing infections into the country. This question over here.
On the trans-Tasman bubble, from a health perspective, obviously the sort of final decision will remain with Cabinet, but from a health perspective, where would cases in Australia need to be for you to be comfortable with us opening the borders? They've had more than 100 in the past 2 weeks, for example, whereas we've had 5 or something like that. Where do you draw the line?
So I think from a number of cases perspective, from a health perspective, there are 2 relevant things here. One is the cases and the pattern of cases, and whether there is evidence of community transmission where it's not clear where they've come from. That would be a concern. So that we'll be looking at that. And then, of course, there is the full pathway of people coming across the Tasman and going back, and making sure that any risks could be managed there. Both countries will be interested in that. But again, I think the key thing we'll be looking at in Australia is where are the cases and can they be explained? And those are the things that will be influencing decisions inside Australia about travel between states as well, I would imagine. So I think we will see, once there is a degree of comfort with travel between states in Australia, then it may well be they feel they're ready, and I can't preempt the decision by the Australian leadership, they're ready for that trans-Tasman arrangement.
Does the same apply to the Pacific? I mean, what would it take for the Health Ministry to give the green light for including the Pacific in the bubble?
Yeah, so we will give advice around that if asked. My own view is that again, the risks can be managed well, especially if we've got countries that have got good testing in place, and we know that they haven't got any cases, and that the arrangements can be put in place for travel to and fro. I think that many Pacific countries will be interested in seeing if an arrangement can be put in place, because their economies are so reliant on tourism, and so the Pacific is, I think, has always been a focus of our efforts in response to COVID-19, and it will be in terms of opening up travel, but I haven't been asked for specific advice on that yet.
The University of Auckland sent out a letter yesterday where they said that they are going to be offering the government residence halls as an option for quarantine and mandatory isolation of incoming international students. Would you be open to expanding those systems beyond hotels to new venues?
Yes, the venue is one thing. It's the incredible arrangements that are in place, and having visited one of the hotels in Auckland last Friday, it's quite a complex operation, 24/7, health oversight, security, the way food is prepared and delivered, the arrangements to ensure people can get out for physical activity, making sure the well-being of those people in the hotels, or in this case in student halls, was being looked after. So if an accommodation block is appropriate, that's fine, but it's really the ability to stand up all those services around it. And just a reminder that at its height in Auckland, there were over 500 people involved in those arrangements. It's still somewhere between 300 and 400 people to provide that full range of services across the 12 hotels there in Auckland at the moment.
Do you know
when was the last case we had? When was the last time we had a case of community transmission?
In the first part of April, having gone back and looked at all the cases, in particular those ones where it was not entirely clear exactly where the transmission or where the person may have been infected.
I'm interested to know what feedback the Ministry of Health got from the Prime Minister around her Early Movers initiative with world leaders last night, whether anything of interest came out for the Ministry?
I haven't actually followed up or had any feedback yet from the Prime Minister, but I'll be interested to see what that is. But the PM herself may well speak about that.
Tomorrow at midday.
Apologies if you were asked about this yesterday, but we have a reporter who is usually a correspondent in Australia who's in managed isolation in Auckland at the moment, and he says he was rung by Healthline 3 separate times telling him that they lost his information and that it was due to a technical issue. Is this something that you've heard about, or is it a common problem that you're aware of?
No, it's not something I've heard about, so I'm happy to look into that. The hotel I visited, which was managed isolation, one of the ones in the Auckland CBD, actually the health checks there, and I imagine it's the same, that the daily health checks are done by nursing staff who are actually on site. I met the group of nurses at the hotel I visited, and they do either phone calls to people in their rooms or they see them personally. They've got a special area set up for that each day. So I'm not quite sure what the Healthline issue was there, but I'm happy to look into that.
They were saying that they didn't know when he'd arrived in New Zealand, where he'd come from, what hotel he was in, or how much longer he'd be there for.
And he's there at the moment, is he?
Yeah.
Okay, we can check that.
Tomorrow at midday, the country are allowed to have gatherings of up to 100. Are there any major concerns that you have that we go that extra step?
No concerns, that was our advice, and I'm also confident that New Zealanders will keep following the precautions and expectations of them, including registering and just looking after each other, whether it's out in a public venue or at home in a private setting, or at a special occasion like a wedding or funeral. We've still got to keep keeping each other safe, and I encourage people to do that. Any final questions?
Yes, sorry. I've asked the Ministry of Health to provide data of healthcare workers infected in their workplace, and they haven't been able to do that. Is that good enough? Is it, given it's a work safe issue?
Actually, there are data already on our website around healthcare workers and how the proportion that have been infected either in their workplace in a healthcare setting or in other settings. So I'm not sure if you were looking for detailed data on every healthcare worker. I'm not sure we would have that level of detail available, but I'm happy to follow up your inquiry.
Yeah, isn't that something that should be available, given it is a sort of health and safety issue? If someone is infected with a deadly virus in their workplace and they say that they don't have data, or they've told me they don't have the data on the number of healthcare workers who were infected in that healthcare setting.
That surprises me because I think for about a month, probably a month ago, I started to talk about the number of healthcare workers, broke them down by groups, and also what the place of likely infection was. So let me just check that, and if those data haven't been updated, we'll make sure they are. Final question.
On the vaccine strategy, there's been some concern raised, including by a Member of Parliament, that there would be some level of forced vaccinations for COVID-19. Can you address this?
Yes, people may have raised it as a concern. It's not something that's in our thinking, because I don't think we will need to force people to be vaccinated against COVID-19. And I imagine that everybody, just as they have in our efforts to date, will be keen to ensure that both they and their families are protected, and also that they are contributing to our wider community effort, and they're protecting others, in particular vulnerable New Zealanders who would not do well if COVID-19 was still circulating in the community. So I think we've crossed that bridge when we get to it, but I'd be very surprised if New Zealanders don't get right in behind an effort if the vaccine's made available and they can get one. Okay, thank you very much. Appreciate it. Have a good long weekend.